Our early treatment program focuses on young people who are experiencing the onset of a psychotic disorder.
Many advanced mental health conditions begin in young adulthood.
Young people are confronted with the stresses of negotiating completely new environments.
They may be in college, they may be at their first job, and they develop a psychotic illness. Obviously, very frightening, but at times hard to recognize.
This is the critical window for treatment and intervention in a patient who's probably going to have a chronic lifetime disorder. Our research is focused a lot on the genetics of schizophrenia and other psychiatric disorders. We'll be able to better diagnose the disorder and understand what causes it, but also down the road we'll be able to actually understand how to better treat the disorder.
About 3 or 4 years ago, we developed what's called the North Shore LIJ Behavioral Health College Partnership. And this has now evolved to about 15 regional colleges or universities where we have partner relationships with student counseling programs.
Where you're treated first matters most. And early intervention is the most critical component to changing the trajectory of illness, of getting someone well.
One of the exciting elements about the new hospital is a dedicated unit for young adults and college students and our early phase illness population.
Young adults have very specific lifestyles. This unit has a combination of the ability to have some privacy, to socialize, and also promote activity.
I think patients learn a lot about their own illness by speaking to other people of the same age with similar symptoms.
The key in working with this population is having a trained team that can provide state-of-the-art interventions, all focused on that individual to bring about recovery.
One of the more exciting findings over the years here was made by Dr. Kane, where he and his colleagues found that this drug, clozapine, was the most effective antipsychotic drug for those patients who had treatment-resistant schizophrenia. And this is a real breakthrough.
One of the programs that's offered at the Zucker Hillside Hospital is a specialized outpatient clinic for the use of clozapine.
It works so well in helping our patients live full and productive lives.
Many of them have been able to go back to school, many of them are working.
Clozapine really actually revolutionized the treatment of schizophrenia and is still today the best treatment for these kinds of patients. So it's very, very critical that we have these kind of research findings that really impacted the treatment of our patients.
To see that we're able to help them, it's really a very good feeling.
We're providing the best opportunity for each young adult that's under our care to lead a productive life.
We think that we can become not only a regional center, but a national center for college students requiring short-term hospitalization.
We want our patients to want to go home and resume their life.
We want to help them make the best possible adjustment that they can in the community, and we want to help them avoid having to come back into the hospital.